Hello there and welcome to my Zone Online School. My name is Mr. Ashela and I'm here today in the studio with my friend. This week's theme is health education, but before we begin, I would like us to sanitize our hands. As we all know, we have to abide to the COVID-19 rules. We have to do it thoroughly through your hands, around your thumb, even on top of your hands. Okay, and when done that, make sure your hands are dry. And do the distance drill to make sure that you're not touching anyone. And today's lesson is community health. Grade 5s, let's turn to page 14 for this week's lesson. This week's theme is health education, and our topic is community health. We'll start with our basic competencies. I'll go through one by one. I'll start with the first one. Identify and report on local health factors and services affecting the health of individuals, families, and the community. Describe and relate how lack of provision of local community health services affect the health of people at home or at school. Right. To understand our basic competencies, we'll begin by pinpointing or picking out the difficult terms that we might have problems with. We'll start or we'll begin with the term community. Right. It says here, a group of people living in the same place or having a particular characteristic in common. Right. What does this mean? This means your community is basically your area where you live, be it at home or at school at that point, if you're at school, or any other location where you interact with the people or the animals that are around you. Right. Health. The state of being free from an illness or injury. Right. This one is quite straightforward. I don't think we need an explanation on that one. Health care. The organized provision of medical care to individuals or a community. This is provided mostly by our government, the nurses, the doctors, and so on. Right. Medical. Relating to the science or practice of medicine. Right. This simply means that it relates to things that have to do with medicine, science, as in the doctors, the nurses, and everybody that basically gives service that have to do with your health. Right. Let's begin now our lesson. Let's tackle the basic competency 1. Right. Local health factors affecting the health of individuals, families, and our community. Right. I've made a spider monkey here for us with our health factors or things that affect our health in our communities. We will start by, we will begin by pinpointing out these factors, which were already pinned out here by my friend, which is community safety, environment, the money, housing, and a job. How do these things affect our health? Right. Let's start with the job. For instance, if your mommy at home doesn't have a job, and you get sick, how do you go to the hospital? Because at the hospital, we pay a certain amount, and if the mom doesn't have a job, it means there's money to pay for the services that are offered at the clinic, for instance. Right. Housing. How does this housing affect us? How does it affect us? If you don't have a house, for instance, if you don't have a house, okay, not say you, but maybe street kids, we know we have street kids that are living under the bridge. Those kids will not be safe because then they are being exposed to the cold, the heat, and being bitten by mosquitoes. There's just no safety at all. Right. Now that we have looked at the factors affecting the community, let us look at how the lack of provision of local community health services affect the health of people at home. Right. The first one is the common one. So it's here, lead poisoning. This is the water that we get from our taps at home. When you see it looks a little bit brown, it means it has lead content in it, which means that water is unsafe to drink. So the best way to keep it clean is to boil the water, have it, or you can buy water at the service that looks clear. It shouldn't look a little bit brown, because this causes or affects the brain or the nervous system, which will result in poor concentration in class, or maybe a child being born with a certain disability. All these things are caused by lead poisoning. And that's what is standing there in our book. On page 15, we have substandard housing such as water leaks, poor ventilation, dirty carpets, and pest infestation can lead to increase in molds, mites, and other allergens associated with poor health. This simply means that it's the little things, even just cleaning the dishes at home to prevent cockroaches. Cold indoors conditions have been associated with poor health, including an increased risk of heart disease. Extremely low and high temperatures have been associated with increased mortality, especially among vulnerable populations, such as the elderly. And residential crowding has been linked with both physical illness, such as tuberculosis and respiratory infections, and with psychological distress among both adults and children. And now with the current pandemic going on, COVID-19, it means that these households will find it very hard to keep up with the prevention measures of social distancing if they don't have houses, for instance. Because most of our houses in the outskirts of Windhoek have no structure of streets and stuff, so they just piled together, and the people don't really have enough space to distance themselves. So because some of them live 6 in a kabashu and so on. Now that we have looked at our health factors affecting our communities, we also looked at how the lack of provision of local community health services affecting people at home and at school. We will have time for our quiz. Let's have a look at our fun quiz time. Our first question for this quiz is, name any type of health factors or services affecting your community. The second question is, how does lack of provision of local community health services affect the health of people at home or at your school? Right. You can just note down at the notes there where it says notes in your booklet. You can give answers there and get help from your auntie, your uncle, your mom, your dad, your brother, sister at home can help you answer the questions. Right, I hope you enjoyed today's lesson, and also remember to always sanitize your hands. Remember your social distancing. Always wear a mask in public. And from us in the studio, until next time, ciao.
Joshi, and make sure to always make a helicopter circle, stretching your arms out and spinning around like me. And make sure you're not touching anyone while doing this. Goodbye.
It's ShopRite's big low price birthday. We're celebrating with big deals and even bigger savings. Like 10 kilos Pocomo Fed Cook wheat flour for only $109.99 and 750 grams Ricoffee instant coffee for just $79.99. Don't miss out on our big low price birthday. Only at ShopRite.
Hello then, welcome to My Zone Online School. My name is Mr. Ashela, and I'm joined here by my grade 5 learner. This week's theme is health education. But before we begin, I would like us to abide to the COVID-19's rules. We'll begin by sanitizing our hands. You must make sure that you rub the sanitizer thoroughly to your hand, around the thumb, and do the distance check. Make sure you're not touching the next person next to you. And today's lesson, we are still discussing community health. All right, grade 5. Let's turn to page 29. We will begin by going through our vocabulary check. I will start with patient. What is a patient? It says here, a person receiving or registered to receive medical treatment. Healthcare. What is healthcare? The organized provision of medical care to individuals or a community. What is immune? Resistant to a particular infection. Medical. Relating to the science or practice of medicine. Right. For this lesson, we are going to talk about PHC. I know you're sitting there wondering, what is PHC? Well, PHC stands for primary health care. So the P is for primary, the H is for health, the C is for care. Right. We are going to look at the roles of PHC, or the things that PHC provide us with. Says here, the main role of primary health care is to provide continuous and comprehensive care to the patients. The second point is, it also helps in making the patient available with the various social welfare and public health services initiated by concerned governing bodies and other organizations. What does this mean? It means that PHC is supposed to be provided by the government. Of course, we cannot build our own hospitals. We cannot have our own doctors at our house. You're lucky if your mom is a doctor, for instance. But this is the role of PHC, which means the government should provide us with the doctors, the nurses, the places like the hospitals, the clinics. That's what PHC stands for, or the role of PHC. Right. Who provides PHC? Like I said earlier, PHC is provided by the government, but the government doesn't come to us. It sends people like the nurses that come to school for immunization, or the doctors when you have a toothache, you go for the dentist. Those are part of the PHC. Right, let's turn to page 30. Here it says, make and carry out a plan to promote activities that will improve the health situation at home and at school and support the PHC system at the same time. Well, here, we are looking at the things that we can do as individuals to help promote health and prevent illnesses at home. Right. What are these things? For instance, the first thing that we can do is get ourselves immunized, right? You get immunized against diseases. We should always make sure that our places are clean. That's why it says that we should throw away rubbish in dustbins or skip containers, not just out there because we are throwing it out. We should also make sure to bury garden refuse, to practice eating healthy, exercise on a regular, bath every day, and keep your house and yard clean and tidy. Right. Okay, I spoke about immunized against diseases. So some kids out there sitting at home and wondering, what is immunized? Right. Here it says, explain the concept of immunization in simple terms. So I'm going to go through with you at home. I hope you are watching and really following. Right. Immunization is the process whereby a person is made immune or resistant to an infectious disease, typically by the administration of a vaccine. What does this mean? It means that you get an injection from a doctor or a nurse with a vaccine that will protect you from a certain disease. Like, for instance, right now, we are sitting at homes in panic of the COVID-19 because we do not have a vaccine for it yet, right? So these are the things that are being spoken of. You see, if we don't get immunized, then we will be infecting others, we'll be spreading the disease, and a lot of people are dying, as you're seeing on the news, right? A vaccine will stimulate your body's own immune system to protect you from a certain disease, right? So what the vaccine does, they give you a certain, it's more like a medicine, yes, let's put it that way. It goes in your bloodstream, and then it helps your body fight against germs, bacteria, and viruses, right? Next point, yes. Explain why children should be immunized against common diseases when they are young, right? Here, when you are young, your body is growing, not just physically, also mentally, and your immune system is also growing. So it means the best time for you to get immunized is when you are a child, so that your immunity grows with you. That's why it's important to be immunized when you are young. Right, here the points are saying, immunization is a simple and effective way of protecting children from serious diseases. Diseases like polio, that's one of them to mention. It not only helps you protect individuals, it also helps the broader community by minimizing the spread of the disease, right? Vaccines work by triggering the immune system to fight against certain diseases, right? What does this mean? It means that if, for instance, let's say we get a vaccine for COVID right now, it means we will have to immunize from the earliest kids, from the youngest kids to the adults. They all need to get immunized to protect us, because then our bodies will all be made resistant to this disease. Right. Before we say goodbye, I'd like us to turn to something fun. Let's go to our fun quiz time. We have 3 questions there that you can do on your own or with the help of your parents if they are around you, or your cousin, or simply whoever you have there. Right. Question 1. What is meant by PHC? Question 2. What is the role of PHC? Number 3. Explain immunization. Right. Now, with that in mind, let us still sanitize our hands, keeping our COVID regulations intact. Make sure that you rub all over your hand and do the distance drill all the time. Don't forget to wear your mask. And from us here in the studio, until next time,
Hi everyone, I'm Joshi. And make sure to always make a helicopter circle stretching your arms out and spinning around like me. And make sure you're not touching anyone while doing this. Goodbye!
Hello, my name is Lara Solomskutsia, and this is my message to you. We all have a choice. Your choice does not only affect you, but mostly affect those around you. Please stay at home in order for you to help us save lives. This is not a rehearsal. Please stay at home.
What's up, world? This is Shay, the goddess of the airwaves, on 99 FM, Monday to Friday, serving you breakfast on the ignition between 6 and 9. We brought you to be inspired, taking you to master your destiny. Now it's time to do the work.
Just show up. Put on your work boots and do the time.
Make it, and then make it better.
Hello world, it's your boy Script here on The Kingdom, where we're reminding you every single day.
Get up. You've got this. Start where you are.
Hey, this is your girl Treza on Hitsville on 99 FM, letting you know it's okay.
Try.
Make mistakes.
Ask.
I am Sibo, and I'm going to be with you for quite a while. Thank you so much for joining us here on your inspiration station, where we let you know
There's no easy money. There's no easy job. There's no easy life.
99 FM. Do the work.
Catch Namibia's rising talents displaying the best goals, breathtaking saves, Khafar like a 1-2 combination on the pitch, as well as the biggest misses. It's the MTC Hop Soul Youth League Soccer Show, showcasing Africa's next soccer superstars. Only on One Africa Television, every Wednesdays at 18:30. Aye, it's Super Disc on another level.
Hi beautiful people, this is Nikita Winkler and I am here to share easy tools for stretching that you can do just about anywhere. This is a demonstration, so what's most important is that you take enough time in each position that your body requires to release its tension. So let's get started. In this session, we will be stretching the ankles and feet. So first I'm going to spread my toes and make sure that my feet are grounded and aligned with my knees and my hips. And what you can also do here is lift one toe and then the other ones. This is really good exercise to strengthen the muscles in your feet. From here, we're going to press forward to open up the ball of the foot. And we make sure while we're doing this that the ankle doesn't sickle. By pressing towards the big toe to align the foot, the ankle with the knee and the hips. Next, we're going to go into ankle rotations. We're going to do both ways. You can do this on the floor, and for more freedom, you can take it off the floor. You can also do all of these stretches sitting for more comfort. And then we're going to tuck the toes to stretch the front of the ankle. So in this stretch, give pressure to the front of the ankle. You'll feel the stretch in the toes and in the ankle. And you don't have to keep it for too long. Also make sure that the ankle doesn't sickle in this stretch, but that you're pressing towards the inside. Right. Now we're going to go into foot massages. First, I'm going to massage in between the bones of the toes, to open up the foot, and then I'm going to use my thumb to dig into the arch of the foot, giving it circular motions or whatever feels good. And then I can go to the heel, again using enough pressure and using the thumb. All right. If you position yourself comfortably for your foot massages, you can take as long as it feels good. So thank you for joining me. Don't forget to breathe and happy stretching.
We hear of a health innovation in Cote d'Ivoire that allows people to carry their personal and medical data on them in the form of jewelry.
Do I actually have to come for every single antenatal clinic? Because those things are tiring.
Thereafter, we have the answers to the 5 frequently asked questions on maternal health on our weekly segment 5 Under 5. We also find out what exactly goes on in an intensive care unit and the crushing stress that comes with it. But first, what do you do if your baby is choking? We hear the untold stories of what could happen when a baby's choking gets serious and goes unattended.